on the occasion of International Day of Yoga. And we have conceptualized this program when we started in the first EC, and thanks to my president, Dr. George Reddy sir, who has been very keen, and we are doing this program continuously, and we have not missed any important occasion, and conducted almost 6 webinars now. This is the 7th webinar. And to welcome today's proceedings, I welcome our president of Indian Psychiatric Society, Telangana State Bank, Dr. George Reddy sir. Sir, welcome, sir.
Thank you, Pawan.
And now I invite Madam Nirmala Madam. Madam, welcome, Madam.
Thank you, Andy.
Thank you. Now I welcome today's speaker, Dr. Kishen sir, Professor and Head at the Pratima Institute of Medical Sciences, who is a mentor to many. Sir, welcome, sir.
Thank you, Pawan.
Sir. Now I welcome our Treasurer, Dr. Narayan Rao, sir.
Thank you, sir.
I welcome our Editor, Dr. Sai Krishna, sir.
Thank you, sir.
Now I welcome our dynamic Vishal Akula, who is the Mental Health Awareness Committee Chairman. Welcome, Dr. Vishal.
Thank you, Pawan bhai.
And I welcome all the delegates who have joined us for this webinar. And over to you, sir, George, sir.
Thank you, Pawan. Respected chief guest for today's occasion, Madam R.S. Nirmala, today's speaker, Dr. P. Kishen sir, and all the office bearers, EC, all the members of the Indian Psychiatric Society, Telangana State Branch, friends and family members, and all the attendees who are here, a warm welcome to you all. On the occasion of the International Yoga Day, I think I am fortunate during my tenure as the president. We started our tenure as the program was first with the International Yoga Day, and I think I'm fortunate I'm getting it the second time, and we are ending it with the International Yoga Day. I'll be ending my tenure, as you all know. This Saturday, Sunday is my last day for my term as the president, and I'm fortunate that it's coming here. I was just trying to, think why is that I have been getting it too much of interest into yoga, and why is that I'm trying to put in a lot of efforts even in my practice. The simple reason I was trying to just look at was like our seniors, Dr. B.N. Gangadhar sir, Dr. Kishen sir, they all are trying to advocate, and it was just not advocating. There's a lot of research and there's a lot of evidence-based psychiatry which is going on, and NIMHANS Bangalore is showing they're presenting so many articles where they're trying to connect to yoga and trying to link up the mental health issues like depression, anxiety, schizophrenia, so many health issues, sleep, whatnot, apart from so many other physical conditions, as we all know. And thanks to our Indian Prime Minister, I think now the UN Council also has declared the International Yoga Day, and many countries have unanimously accepted, and that's where we see it as a festival rather than a simple day. I think we are observing it as a festival, and people just coming on the roads today morning at various places, I'm able to see that there's a lot of awareness being created for today. Coming to today's program, our chief guest, Madam R.S. Nirmala, I'll introduce her. Madam, are you there, Madam?
Yes.
Thank you, Madam. Thank you, Madam. Thank you. And Madam runs Nirmala Yoga Center at Alwal over the past 20 years. She has done her architecture, and then she has started to follow her passion for yoga and wellness and health. I think that's where her credentials start. She has totally dedicated herself to the cause of yoga, wellness, and health. And then she's a teacher to thousands of people across the country, and many are overseas also over the past 20 years. And she has given, she's a certified trainer to many students, and many of our students are settled as professional yoga teachers. We have seen her students doing a wonderful job recently on 18th. Many are running wonderful yoga centers. I think that's where she stands. She's guru to many gurus, and she's an NCC cadet and C grade holder, and she represented United AP at Delhi in the Republic Day Army Parade and brought medals to our state. And she's also a certified aerobic instructor, certified breathwork instructor. She's a certified NLP instructor and a certified PLV instructor. And she takes a lot of classes for the corporate sectors, bank employees, industrial workers, to many schools and colleges. And today happens to be, we are fortunate that it is 20 years of Nirmala Yoga Center. And Madam, we are fortunate that we are spending the time with you on this occasion, Madam. Without taking much time, and I invite you, Madam.
Thank you, sir.
And next, our speaker, Dr. P. Kishen, sir. I think our psychiatrist need no introduction about Dr. P. Kishen, but Madam, Dr. P. Kishen, sir, is one of our mentor, and he is a professor and head of the department at Pratima Institute of Medical Sciences at Karimnagar, and he's one of the senior psychiatrists in Karimnagar, and he's one person who advocates yoga, and he has a lot of passion for spirituality, yoga, and mental health. And we are fortunate that he's as the speaker, and you'll see his presentation. I think he mesmerizes with his, linking up mental health, yoga, and spirituality. That's where Sar stands, and he's a part of the National Indian Psychiatric Society, the spirituality and yoga team as chairperson. He's in the SARC committee for mental health also. And Sir has been president for the Indian Psychiatric Society South Zone branch. And he has done wonderful activities, and he's a teacher to many of the psychiatrists who are practicing in Hyderabad and various places across Telangana. Sir, welcome, Sir Kishen, sir.
Thank you, Dad.
And,
Please.
and now I request Mr. R.S. Satyanand, sir. Madam, sir, unnara, madam?
Yeah, sir.
Namaskaram, sir. Namaskaram, sir. Sir, on behalf of the Indian Psychiatric Society, sir, we request you to felicitate Madam with a shawl and memento and the floor. Sir, please, sir. Dr. Satyanand, sir, is very active, and I think is the man behind Madam. Thank you, sir.
Thank you all. Thank you for inviting me. Thank you for this felicitation.
Thank you, Madam.
Thank you all.
Yes, Madam. Madam, I request you to give your valuable message, Madam, on the occasion of the International Yoga Day.
First, I would like to thank all of you for inviting me to this wonderful program. And happy International Yoga Day to all of you. Our Prime Minister, Mr. Modi ji, had made us a little more proud, because today record was, a Guinness record. Today it was a Guinness record because he had done yoga at the UN Council along with members from 180 countries. So the theme of this year's yoga, Vasudhaiva Kutumbam, I think, that was fulfilled today. So it's a really proud moment for all of us. Yoga has gained lots of prominence now on an international platform, all thanks to our Prime Minister. So talking about today's program, the well-being, the role of yoga. By well-being, what do we mean? Well-being is nothing but a state of being comfortable, healthy, and happy, isn't it? So how do we achieve this well-being? Since I'm a yoga teacher, I would say through yoga, you can achieve the state of well-being. Now, what are the different types of well-being? It could be physical well-being, it could be, emotional well-being, it could be, social well-being, intellectual, and then spiritual well-being. Now, since this is a psychiatric society, let me talk more about mental well-being. How can we achieve this mental well-being? The state of well-being has been, uh, talked about 5,000 years back by Rishi Patanjali. He has advocated the 8 limbs of yoga, or also known as the Ashtanga Yoga, where everything is explained and described properly. Now, the study of psychology in general had been started just around 169 years ago in Germany. I think most of you might be knowing the study. But Ashtanga Yoga was written around 5,000 years back, which is relevant even in these days. Now, how to achieve this state of well-being? The 8 limbs of yoga. Let me tell you what are the 8 limbs of yoga. First one starting with the yama. Second is the niyama. Then comes the asanas. Then comes the pranayama, pratyahara, dharana, dhyana, and samadhi. So, asanas comes in the 3rd state. Asanas is nothing but our physical well-being. After that comes the pranayama. That is our internal well-being, your breath work. Pranayama is nothing but the breath work. Okay. So when you focus on your breath work, you try to improve your mental health. I think the COVID has taught us an important lesson where we need to take care of our physical health and our mental health. Especially after the COVID, I have seen many people having issues with their mental health. Like, it could be depression, tension, stress, panic attacks, anxiety, and many more. And I have seen that the breath work really helps in improving the, mental health of all these things. It is simple. You don't require any medicines, anything. Just by focusing on your breath, most of them have seen a drastic change in their mental health issues. So what are all the pranayams or breath work? It is the, starting off with the basic, or you can say the queen of the pranayam, that is Anulom Vilom pranayam, Kapalbhati pranayam. Then we have the Shitali Shitkari pranayam, Surya Vedani pranayam, Chandra Vedani pranayam. There are so many different types of pranayam which helps in improving your mental well-being. But these have to be done under an instructor, because people tend to have many other health issues as well, like combination of high BP, combination of asthma, thyroid, and all these things. So it is better to do it under an instructor for a better well-being. Now, Patanjali Maharshi, he has advocated these 8 steps for a complete transformation. It is not what you do 1 hour on a yoga mat. It is how, you transform yourself completely. The way you speak, the way you eat, the way you think, all these things matter. But generally people think that just by doing a few asanas, a few pranayam, that you are a true yogi. No. I would say you need to follow all the steps of Ashtanga Yoga to be called as a true yogi. So complete transformation is required. As I said, all the steps of well-being, what all we had discussed before, like spiritual, emotional, physical, and social well-being, all these things matters. You can't differentiate everything. Everything has to be taken care of. So yoga is a union of body and mind. So complete transformation is required. Do you have any questions to ask?
Madam, thank you, madam. We'll put it at the end, madam, after the presentation.
Okay, okay. So on this International Yoga Day, I would ask each and every one of you to improve yourself, to transform yourself. You can take this as a day, to bring a change in yourself mentally, physically, emotionally, and spiritually as well. So let us take this day because there are so many changes happening everywhere. So we need to protect. If you want to protect your mental health, your physical health, yoga is the best solution, I would say. So start practicing yoga. Yoga really helps.
Thank you, madam. Thank you very much for the message, madam. Before we start the webinar, Kishen sir, shall we start, sir?
Yeah, please.
Yes. So, sir, over to you, sir. Kishen sir.
Sir, President sir, with your permission, sir.
Yeah.
Sir, I would like to welcome Minas sir, who has just joined, sir, the President-elect of IPS TSB.
Welcome, Dr. Minas bhai.
Minas sir, welcome, sir.
Thank you, George bhai. Thank you, Pawan. Good evening, Kishen sir. Good evening, madam.
Yeah.
Good evening.
Won't come in between. Sir, please start, sir.
Before starting my talk, may I request the slides to be shared? Oh, yeah. Then, first of all, I want to tell thanks to Telangana State Branch, and particularly to George Reddy, and for his very affectionate introduction and other adjectives he used, whether I don't know. Okay, to come to for my humble presentation, let me please. Can I have slides? Okay, I'm sorry. I'm sharing. Please.
Yes.
Yeah, coming to this well-being. The topic is well-being and role of yoga. So let us know what is well-being. Before the well-being, the definition of the being, there's the animal being, well-being, ill-being. So what that being is a link, which links one's sense of one's body to one's perception and his own world. Every person will have their own world. The ill-being also their own world. In well-being also dimension. So ordinary well-being and higher well-being, their world is different. So coming to well-being is the individual's experience as well as a contentment and satisfaction of the past. Satisfaction of the past and optimism for the future and happiness in the present. Coming to ill-being, a state of lacking of health, happiness, and contentment. So why we are concentrating on well-being means the WHO has given definition of health, though it is not only mere absence of disease, it is a physical, mental, social, spiritual well-being. So that is the goal of our our medical field, to make every being, every human being to a well-being. So coming to this dimension, so you can see this illness to wellness continuum. So the person is a normal person in the middle. So there's a severity of illness, the ill-being also, is a maybe mild ill-being and severely ill persons. So the well-being, even normal person and person we call as a well-being, but is a higher well-being, the dimension of well-being. Ordinary person is different, and the extraordinary person is different. Like great yogis, they're different. They're in different level of maturation, evolution. Coming to different types of yoga, you can take the Hatha Yoga, main what you today asanas are Laya Yoga and Mantra Yoga, Raja Yoga and Tantra Yoga and Bhakti Yoga. There are different types of yogas, but the principles are same. That is Ashtanga Yoga, the Patanjali Ashtanga Yoga is the basic principles of any yoga. So Madam Nirmala ji explained everything that this Ashtanga Yoga is important. And everybody, if you want to become a yogi and practitioner to attain a well-being, especially higher well-being, should follow all these steps, not only this third one, asanas. So Yama, everybody knows that the good and bad, in nutshell, is having 5 components, and Niyama also will have 5 components. So good and bad, certainly the goodness will allow us to mature and to go to well-being. Certainly the bad components will be certainly leads to the ill-being in physical health. It will spoils the physical health as well as the psychological health. Niyama is a discipline of the daily discipline, and so a person will have some niyamas to be followed. A discipline in the life and discipline, daily discipline, other disciplines. Coming to asana, the postures. So I will come detailing about this. Then pranayama, Madam explained. So increase the oxygen level. There are different pranayamas and methods of pranayama. Then this basic is to increase the oxygen level in the body and brain. And pratyahara. Pratyahara is to control the senses. If you take the tortoise, the 5 protrusions, all 5 protrusions are comparable to the 5 senses. So from birth to death, the senses go to the world, world knowledge, and it will acquire the knowledge. And sometimes it may spoil with bad knowledge, and it will drown into illness. And so if the self-control is good, they will go to the better evolution in the life. The last three are dharnas. You are focusing on one object. That means be MBBS or MD or yogi. Better yogi means that is a focusing. I want to become a yogi. That is you are focusing on one object. So you have to do dhyana. That is you have to continually work towards that goal. Then you attain that identification of your goal. That is a samadhi. These 3 parts is common to higher wellness. So coming to what are the asanas? Everybody tells about yoga and asanas, but there are some principles should be followed and some steps are there. The first yoga, every yoga posture involves some steps of that yoga, that is vinyasa. Then shvasakrama, every yoga in that they will tell that breathing pattern for that particular posture. And you have to put your attention and vision. You have to put your vision in a particular place, and drishti should be on focus, should be on certain points. Then sthiti is a position, and at that position means, for example, you take trikonasana. Trikonasana is having a position. So for you attaining the position, you have to relax in that position. Then you have to experience that. If you don't experience it, you will not get the results. So simply doing all asanas fastly, you will not get that should be, and you must be mindful throughout the process, from the each and every step, and you must be mindful about shvasakrama, and where you are putting attention is also with mindful, and that is sthiti, that is attaining full, what is the 3 end of the asana should be, every step should be, you have to do with mindfulness. Better to do in open place, that will have much more better effect of asana. And unless you do this, you may not get the good results. You will get result anywhere. If you 10 by 10 room also, you can get the result. But if you follow these principles of that asana, then you can get good result. Coming to, I'm having my own module of yoga module, Prashanti yoga module. Anybody, if you can ask, I can send it. And because I am started wellness clinic 9 years back, I am continuing this. And my postgrad is also trained with this yoga module. Nimhans developed, I think, thanks to Gangadhar sir and Shivaram, Varamali, as well as Naren, all the group, we have done work together, and they have done, Nimhans has done wonderful research and yoga science. Now today, whole world bending their bodies on International Yoga Day, but world is not going to follow. There's still some countries are resisting. Unless you produce science of yoga, nobody is going to accept it. So to become a world guru or something different words I don't want to use, but world will listen to us if you produce sufficient evidence of yoga. That the recent last 2 decades of research produce a lot of science of yoga. That's why I will narrate this following slides. Yoga has been found effective in stress management, and yoga has been proven positive effects on blood glucose and lipid levels, the increased cognitive performance, including memory and executive functions, and motor coordination, and neuropsychological markers, stress and sleep pattern also improves with the yoga. So what are the other benefits of yoga and psych, that is mind? Psychological test performance are improved, shortened latency periods, and higher amplitude of evoked potentials. Increased gray matter volume, but this is measured by MRI. A lowering of cortisol level, that is stress hormone, will be lowered by yoga. Attenuating oxidative stress and increased quality of life. These are all conclusions after going through a lot of studies. Yoga, it benefits both physical health and mental health. So coming to the physical health, it down-regulating the hypothalamus-pituitary axis. It helps for physical health also. And it decreases the sympathetic nervous system tone. And there's a difference between yoga and exercise. Yoga is always superior to exercise. Exercise is also having benefit, but yoga is having superior benefit. This is a raw study. Coming to what is the mechanism, how the stress goes to distress, and it gives disease to the body. If the yoga stress, continuous stress for so many weeks and months, to the body, it goes to the disease. If to the mind, it goes to the disorders. So here you can see this stress gives increased sympathetic nervous system activity. Epinephrine is more and norepinephrine, both the heart rate is more, blood viscosity is more, clotting is more, and blood pressure is more, and that is disease. Then other mechanism, hypothalamus pituitary axis, through it increases the cortisol level, glucagon, and blood glucose increase. It increases the insulin. The insulin level is decreased, so blood glucose is increased. So it also increases the inflammation, and it is having a pro-inflammatory stress. So these are all having a behavioral effects, certainly goes to the disease. So through it is atherogenic, more stress, more dyslipidemia, and it causes the disease to the cardiovascular system. So this is how stress. So when the yoga practices, stress will be decreased. Not only stress, the anxiety disorders also decrease. Yoga is effective in treating anxiety disorders in general, particularly in obsessive compulsive disease by Crickwood study, and he has given a lot of details about this and how this yoga helps the depression. Effect of yoga on autonomic nervous system. It also affects on the group gamma butyric acid. Then allow tests in epilepsy and depression, post-traumatic stress disorder is a treated study. What is happening in the stress? Stress, the imbalance comes, yoga, the balance. So completely opposite. So what is happening in the stress? Sympathetic nervous system is hyperactive, decrease hypothalamus pituitary axis, and GABA activity will be decreased. So yoga based all practices, any practice, whatever the yoga guru gives a module, so it increases the parasympathetic system. So decrease pulse rate, decrease heart rate. So all the parameters, healthy parameters will improve. Then hypothalamic interaxis will be decreased and the cortisol levels will be decreased by yoga. Then GABA activity will be improved. So sorry. Yeah. So stress and depression and neuroplasticity. So it is also having role on neuroplasticity. It increases the neuroplasticity by Christopher study. And with this graph showing the yoga in depression, the Hamilton depression rating scores will be decreased by drug. This is the graph. Drug plus yoga, this one. And yoga only is much more decrease the score. Coming to depression and BDNF and yoga. So in healthy volunteers and depressed, so this is the improved levels in both yoga level and yoga and medicine also. BDNF levels are low in depression, rise after treatment and regular practice of yoga, and it helps in raising plasma BDNF levels. Coming to cortisol levels. So significant drop in cortisol occurred with yoga, that is with the 3 months yoga practice. More patients obtained a drop in cortisol with yoga than with medication only. Here, medication, that's yoga plus medication, that's yoga only. Almost is touching the, almost equal, a little superior also. Coming to inflammation, yoga reduces inflammatory signaling, and this is a broader study. By 2 weeks, 12 weeks yoga, and control group, yoga prevented the tumor necrosis factor, the other inflammatory factors. It suggests the anti-inflammatory effect of yoga. I'm not going to details, it takes a lot of time. This everybody can go to that studies and go to detailed reading of this. Everything is available on the net, Google. The structural neuroplastic effects in the hippocampus. After 6 months of yoga practice, in elderly, the hippocampus volume is increased because of the neuroplasticity. This is Rouse and et al. This is published in Indian Journal of Psychiatry. Coming to cortical thickness, Sarah et al. This is a study where meditation experience is associated with increased cortical thickness. Age-related gray matter changes is published in Frontier study, Frontiers in Human Neuroscience journal. The neuroprotective effect of yoga practice, age and experience, and frequency dependent plasticity. So recent our SARC symposium, Bhaskar Mukherjee told that is state dependent and trade dependent. So you can get a wellness state with yoga, but if you go on practicing for hours, total to get that effect, how many total hours of yoga in your life you have done? That is important. That is why this study was done on yoga practitioners, and most of them are teachers of yoga. So they have done throughout life lot of so many accumulative hours. It gives from state dependent to the straight. It will become a trait. So they will be almost their living pattern is very relaxed and highly mature level. So age-related gray matter volume and decline seen in controls, but not in yoga practitioners. So ordinary persons, this decline will be visible, but in yoga practice, the gray matter volume will be maintained for a long period. This is a dose dependent effect. So how many hours? The total duration of hours in your life, if you do more continuously, so generally you will have more effect. So this is very important. Simply if you do 1 week and stop, and you'll do again after 6 months or 5 months, they may not get a good results and they may not have a, then they know that yoga is useful, but permanent changes in the brain and body will not happen. They will not enjoy the real results of the yoga. Coming to functional MRI, the Om chanting produces deactivation of limbic structures. This is published in International Journal of Yoga. Then coming to gene expression in yoga. So even it will have modulation of gene expression. This is a Q et al. Study. So that there is a gene expression also can be modified by the yoga. Coming to telomere strength, length and aging. There is a pilot study published in International Journal of Geriatric Psychiatry, a yogic meditation for a family of dementia caregivers with depressive symptoms, effect on mental health and cognition and telomerase activity. Out of 39 caregivers of dementia patient, 65% showed improvement in the meditation group, but only 31% showed improvement in relaxation group. So meditation is having more effect. Meditation group had 43% improvement in telomerase activity compared to the 3.7 in relaxation group. So this is the evidence for that. So till now I covered normal people with stress or normal people with yoga, and in severely abnormality, schizophrenia, you can take a severe abnormality of the severe psychiatric disease. So there is a yoga evidence in schizophrenia. So coming to the philosophical concept of schizophrenia, schizo means broken, phrenia is the mind, that is splitting of mind, schism between the thought and effect and behavior. So here, between individual and society, it becomes preoccupied, withdrawn from the society. So with yoga, patient will be certainly be more useful in social interaction. I will, for the following slides, I will give the evidence for that. So connectopathy, there's a functional and structural connectopathy between different parts. The white matter connectivity will be improved with yoga. So between frontal and cerebellar, cognitive dysmetria, right and left hemisphere, that is corpus callosum, and even left frontal to right left occipital, there's a longitudinal tract and transfer tracts, both will be improved. So white matter also, the weight of the brain will be improved by this. Not only gray matter, there's a improvement of the white matter and connectivity between different centers. Yoga means itself is a connect and unite, that is huge. That this word came from the from youth, that is yoga. Coming to studies from Nimhans. So this is published in ACTA Psychiatric Scandinavian Journal. Yoga therapy is an add-on treatment in the management of patients with schizophrenia, a randomized controlled study, the Dora Swami study. And there's improvement in negative symptoms and positive symptoms and all scores of the PANS. Totally, you can see the PANS total score also improved. Then other study, randomized control study is addition of, here the control group is added. So as a waitlist patients are added as a control group. Patients and waitlisted patients are compared. Larger sample size, that is yoga group, physical exercise group, and waitlist group. They assess the social cognition using a novel instrument, a tool for trends, tool for recognition of emotions, neuropsychiatric disorders, trends. So there's an improvement in PANS score. Total PANS score is improved. So yoga and exercise and waiting list. So in yoga group, there's a very remarkable improvement in PANS scores, and the social functioning also remarkable improvement is there. Coming to this is Shivram Barambali's study, therapeutic efficacy of add-on yogasana intervention in stabilized outpatient schizophrenia. This is randomized controlled comparison with exercise and waiting list. That is why yoga, nice guidelines uh, uh, has given a guideline of yoga as the therapy for the non-pharmacological intervention. So this on this study, based on this study. So social cognition, effect of yoga therapy on facial emotion recognition deficits. These are deficient in schizophrenia patients, and it will improve by yoga. So what is social cognition? Is you can so facial expression of different emotions will not be properly recognized by schizophrenia, but by yoga this will be improved, and it was measured. So this study is concentrated on that. Coming to mirror neuron activity, mirror neurons are deficient with dysfunctioning persons of the normal life as well as the psychiatric ill people. A person, a motor neuron activity, motor neuron system, motor neuron cells will be improved by yoga. So here the teacher is telling and the students are following, because these are mirroring the teachers, the mirror neurons, they are mirroring the teacher's instruction. Simply whatever teacher is doing, they are mirroring that behavior. You can see in this slide very nicely. So the children learn everything from the parents. So even the animals learn the behavior. The learning behavior, learning and civilization, everything, this mirror neurons is the secret of the how the evolution is going on, civilizations, also the mirror neurons role is there. So this principle is one learns yoga from the teacher. The postures have to be imitated. So they are mirroring the behavior of the teacher. So performing them with mindfulness, attention to synchronizing the breathing with the movements leading to the postures, remain physically relaxed, accept the posture, focus on the experience with each posture, specific breathing practices. This improves the mirror neurons. So what are the mirror neurons? Let us understand what are the mirror neurons, because this is a new concept. So there are two new concepts in recent decades. One is in olden days when we studied 5 decades back, 4 decades back, the neurons cannot be created. But the neurosynapses, generation, these are new hypotheses. Neurosynapses will be improved now. The connectivity will be improved. That is the latest studies. Then this empathy neurons, this motor neurons, also latest concept. This was invented by Italian scientist, and he has done a wonderful study on monkeys. When a behavior, the mixing of the food, we are mixing up the food, there's a motor firing in precentral gyri. Precentral gyri is a motor cortex where he kept the leads in the premotor cortex. When you are mixing the food, there's so many motor neurons are giving deflections. So these are the recorded how many deflections coming in recording. Then when the patient is not mixing the food, the patient's son is mixing the person's son is mixing the food, just is observing when others are mixing the food, like a monkey. There are 20% motor neurons are firing. There are a lot of motor neurons are firing when the subject is mixing the food. When other subject is observing when second person who is mixing the food without any action, there are 20% of neurons are firing. They are called motor mirror neurons. When you are getting massaged, there is a sensory neurons, postcentral gyri mirror sensory mirror neurons are fired. Lot of firing will happen. When you are not getting massage, your son is getting massage. If you are observing that, 10% of your sensory cortex neurons are firing. These are sensory mirror neurons, motor mirror neurons. In V.S. Ramchandran told that there are empathy neurons. So when your student is reading in the seminar is going on and a fan is falling on his head, you suddenly jumps and try to protect him. This is empathy between you and your student. So more empathy, more action. So these are, he also kind that neurons are Gandhi neurons. So here, there are mirror neurons are three types: motor mirror neurons, sensory mirror neurons, as well as the empathy mirror neurons. So proposed mechanism of yoga, there are other oxytocin levels will be increased and motor neuron activity is increased, social cognition is improved, and functional outcome and social interaction and behave in the, it reflects in the whole behavior of the human being. In summation, yoga therapy is associated with observable biological changes in patients and healthy controls. Neurobiological changes are seen in brain structure, function, neurochemical, neuroendocrine, neuropsychological domains. There is improvement, there are changes and improvement. Neuronal system and neuroplasticity are key areas of improvement in yoga by yoga. Preliminary evidence from the genetic studies suggests changes in gene expression and potential epigenetic changes are evident. So these are the, I think, sufficient evidence is there about yoga. And a lot of literature is produced from East and West, including from most of the literature in India is by Nimhans. Coming to this Markandian phenomenon, usually I talk about this. So every person having a history of diabetes in the father, that is, but usually you take that if the father, there's a diabetes in the father, they may come to the son. So the siblings may come. There's a chances, like because of the, everybody knows that this is a through transfer by genes. So that is called in India. Our Sanatana Dharma tells prarabdha. That is something in Urdu tells nasib. So that can be changed. So if you practice yoga, you can change your neurobiology, you can change your behavior, you can change the, that is whatever your learning principles, every behavior which you learned can be unlearned like that. So whatever you got from your forefathers and forefathers, you can change that biology. That is Bhakta Markanda has to live, survive up to 12 years only. He practiced by Mrityunjaya mantra. He became a immortal. So everybody knows, I don't want to explain this. So he changed his, by practice, a sadhaka can, by doing sadhana, he can change his prarabdha. That is the message of this picture. So coming to this, everybody knows the Buddha and Vipassana, Dhyana, he disturbed himself and he sat on Bodhavriksha, under Bodhavriksha. That's in Prakriti. Whatever the Vikruti came to his brain is gone up. And whatever the teaching from him is became Buddhism. So this is the called self-analysis instead of psychoanalysis from the West. So here the body, we believe in Sanatana Dharma, our body is like our temple, and spinal cord is a Dharastamba, the heart is a Garbhagudi, and white matter is a Palasamudra. We cannot see any Palasamudra in the world. You can see the Bay of Bengal, you can see the Hindu Mahasamudra, you can see that sea, but you cannot see the Palasamudra. Palasamudra is nothing but the white matter of the brain can be changed, and by there's a good and bad in the memory. So good and bad is nothing but symbolic. There's a symbolic meaning for everything in India. So the good and bad is something nothing but Rakshasa and Devata. So what the churning is with the support of Meru Parvata, that is Meru Danda is a spinal cord. So whatever by sadhana, they got the Amrita. So your life will become sweet life if you do yoga. That is nothing but churning of Palasamudra, your white matter. Gray matter, that's a good and bad, it discriminates. But so you go above the good and bad, that if you go above, learn how to go above good and bad, you will become divine. That is the goal of our all sadhanas of yoga and different types of yogas. This is everybody knows that phantom limb of V.S. Ramchandran. He got Padma Shri with this. So he treated the phantom limb. This is a phantom pain of 2 years, more than 1 year or 2 years pain in your limb. That was after amputation also he got the pain. With mirror therapy, that was disappeared. I don't want to go to the details of that, but here, whatever the distortions in the brain, he is seeing, is observing his own mind, his own life. He is identifying any person who is doing meditation. You see, Vipassana just simply sitting and seeing the mind. What is Muni? Whoever practices the silence, he become a very observing capacity, improves that. Then the Rishi means right way of seeing. That is a Rishi, English word is a seer. So you know the seeing capacity will be improved by balance of practice and meditation. You can see your own life and mind. What are the distortions in your mind? What are the hot spots? What we call is 6 R's, identifying the red spots, that is the distortions, how to reanalyze that and reframe it and reintegrate. And this is the process of therapy in self-analysis. So where these phantoms, there are a lot of phantoms in the brain. V.S. Ramchandran written a book. There are phantoms in the brain. So whatever the neurotic distortions or psychotic distortions, caste, creed, nationality, these are all phantoms of life. These are all obstructions for human evolution. So if you want to evolve, you have to go to above these phantoms. Then you will go above the dichotomies, all dichotomies, good and bad. There's so many dichotomies in the life, then you will become divine. So this is a Yogeshwara has given Bhagavad Gita, it's a manual for Hindus, and there's a manual of Bible for Christians, and for Muslims, there's a Bible for the Quran. So these are sacred books has given principles how to evolve from the human being. Of course, this also tells that it is a running mind. So telling mind is a Krishna, and the ego is whoever Arjuna. Your listening mind is the ego. The Hanuman simply sitting on the chariot and observing mind. So in the meditation, the observing capacity and seeing capacity will improve. He is seeing how Krishna is telling the Arjuna what is Arjuna is doing, what are the Kauravas are doing, what are the Pandavas are doing. So everything is observing. So that is the process of meditation. So you can become a yogi. Then how the mind works. This is a mind module of Indian module. The Vishnu is the symbolic of the self. He is sleeping on the Vaski is the snake. Nagu, that is Na plus Agu is the non-stoppable. The mind cannot stop it in one place. It goes to Washington, comes back, it goes to Jajreddy, Hyderabad, and it goes to somewhere to my residence. And so these are immediately fastly moving. Very fastly moving is the mind. So snake is symbolic of the mind. If you're able to control the mind, you can use the mind as a comfortable bed to your life and growth and evolution. If you are not able to control the mind, that you can use the mind as a comfortable umbrella to protect you. But if you not able to control the mind, that always bites you. So you'll become victim of life. So for the secret is Garuda. Garuda is having separate vision. When there is a Garuda, snake will not move, it will become statue. So this seeing capacity, observing capacity has to be improved by yoga and meditation. Then you can control your mind, and this is a seat of all illnesses. And it is a ladder to grow to wellness also. So you can see all distortions here. There are a lot of distortions because your mind is not still like water. If you are in still water, you can see your image in a, you can see you distorted image. Always you see a distorted your mind you see, and you act on that. So if you are sit in silence and your mind is still, you can observe what is really happening, and distortions can be corrected, and your life will be happy like a child, like seeing. So in the child, what happens? The lot of connectivity is more in the child. that will be by growth, the synapses will be decreased. That is called pruning. So what happened by yoga? After pruning, by yoga, resynapses will happen. After some age, by getting after adulthood, you are doing yoga, there's reconnections, healthy connections are happening among the centers. That is called probably the pruning, whatever happened from childhood to the adulthood is a repruning, that is the reconnections or resynapses are happening, which are healthy by yoga and meditation, and you will become like child. You see the Gandhi smile. Bosi Navula Babu. If you evolve, your reactions will be different. You will not react at all. You are always reflect to the issues of the life, never reaction. You always reflectly observe, and your way of seeing is different, something above the dichotomies. So it improves the judgment capacity, the internal judgment and external life judgment, and improves the insight. Then you become what is the principle? This Nataraja is a Yogishwara, is also Nataraja, is also Yogishwara, is also Nataraja, the master of arts, is a master of. That's why any drama you will put a Nataraja temple and you will garland him. So because life itself a drama where there's a between that has to be, every person should learn how to play this life drama. If you don't play properly, you will become victim of drama. But if you practice yoga and meditation or healthy practices, you will become the master of the drama, and you will not victim of life, and you can go evolve into the life. Where when Krishna, the Paramacharya, the first guru who told the psychotherapy by Bhagavad Gita to Arjuna, as you know, Kaliya Mardanam, he killed all the, you see, lot of heads to the snake. Now, where the snake was killed by his feet as well as the flute. What is the secret of flute? So, when Radha developed jealousy and by seeing flute. When he went to bathroom, so the flute was kept on the bedroom, on the bed. Then Radha asked the flute, what is the secret? He is not, he is always keeping you with his body. Sometimes he's leaving me, but he's not, he is always, you are always with him. Why he is liking more flute towards flute, and instead of Radha developed that jealousy. Then flute has given answer. You are having ego. You are having that ego that I am the lover of Krishna, but I am not having anything. You see, the both ends are empty. So the emptiness, if you become zero, if you become infinite, like Akasha. So that is the Ambara. So you can see the color of the Vishnu is a blue, color of the Shiva is a blue color, that is a sky color. Color of any Rama, you see blue color, that is the sky, Shunya. The sky is nothing but space. Space is nothing but sea. If you improve the space, the Shunya become the Purna, and your life be very full. And you know, if you become a zero, you know how to become a hero in the life and in every aspect. Then your life will be Navarasa. You can enjoy every emotion in your life by balancing of mind and emotion, thought and emotion and mood. So this is the yoga what I know, what I practice. Thank you very much. Over to Josh. Thank you.
Thank you, sir. I think it was an extraordinary session, sir. Thank you, sir, for linking up evidence-based medicine and yoga, sir. I think many members who have attended, I think they have seen the new form after listening to your lecture, sir. Thank you very much, sir. Pawan, any questions? Shall we take up the questions? If there are no questions, you can raise your hand. We'll promote you to the panelist. You can directly talk. Sir, welcome Dr. IVL Narasimha, sir, and welcome Dr. Suresh, sir. Pawan?
Or maybe he left, sir. Maybe he said he
Pawan
may
sir
have
logged
a
out,
simple.
sir. Maybe.
Logged out. Okay. Sai,
No,
any,
sir, he is there. I just promoted him
you-
to panelist.
He said he is getting a patient, sir. Maybe I don't.
Yeah, sir, there are frequent power cuts, so I got locked off.
yeah.
The attendees list, actually, sir.
Sir, Kishen sir, I have a question, sir, from my end, sir. So now, I think after listening to sessions like yours, sir, I think I am one person who is trying to look at mental health and advise people to practice various forms of relaxation techniques. I think we have our psychologists who do the therapy part, but at least this few minutes of our spending time with our patients, sir, how do we impress upon them, sir, that yoga can do a kind of healing effect? And how do we, the little few minutes, how can we try to counsel them, sir?
No, actually, I used to practice Jacobson's relaxation training in my initial days of practice. Now I'm practicing that, but that is the starting point. So Jacobson's relaxation training is nothing but stretching and relaxation. The stretching and relaxation is a very intelligent. Jacobson is a very intelligent fellow who extracted the total principle of all yoga. So in yoga, different postures, you have Trikonasana, Halasana, so many asanas will be there, where they stretches a group of muscles and relaxation. That takes a long time to get results. And there's a lifestyle, that is a lifestyle, it's different. But for neurotic disorders, he summated every essence of whole yoga of Indian, and probably the patency goes to Jacobson. He trained how to do each group, palm group, form, arm, shoulder, this like that. So first you impress the patient with the Jacobsons, 100% relaxation. You will get 100% relaxation if you do properly. If you do properly, the patient will get 100% relaxation. Then you will impress. And for the patients, first you treat the patient. After recovery, put 1 mg Respirodon or 2 mg, only one tablet for psychotic group. Only one tablet, that is a carbamazepine or sodium valproate or mild dose of Respirodon or fluoxetine. The bipolarity will come down. Then the patient asks, can you stop? So you practice this wellness training, you go to yoga, basic yoga. Then I tell that before coming, he is becoming normal. So you catch some yoga teacher, you practice yoga in your house. Whatever you do that. So I tell advanced yoga in my yoga module is having how to open the chakras with the mudras. The 7 chakras having 7 mudras to open. Then the letters you can also, there is a bijakshara to open that. There are 2 methods. So first you have to impress the patient, and whatever you tell, patient listens. That is your strong therapeutic alliance. First give relief by pharmacological molecule. Very fast relief will come. Don't tell that yoga and this thing in the first phase. To the patient's first pharmacotherapy. For illness, I think even I don't believe in counseling also. I'm sorry to say, I believe in pharmacotherapy. I can give relief to everybody within 10 days or 1 week. Reasonable improvement, or within 1 month maximum. So patient will get relief, he'll get rest, he'll believe on us. So you can tell, and then after 2-3 tablets or 4 tablets, you will write too many, depending upon the condition. Whatever the therapy, then after that you taper the therapy. Taper 1 or 2 tablets, then you send to the yoga. Then he will certainly he appreciates you if you can train. If you are having I'm having a yoga teacher in my hospital. I pay some money to him. He regularly comes 1 hour per day. So he can start. He can make money also on that. So you can have a module. In NIMHANS, you are getting all modules. There is a depression module. There is even schizophrenia. There is a module of therapy. The different asanas. The standardized in NIMHANS. The standardized modules are there because you go to Art of Living, there's a different yoga. You go to Sukhabodhananda, there's a different yoga, different module of yoga. Everybody is telling in different. So now the NIMHANS is very busy to develop generic modules Like paracetamol, crocin will be there, paragesic will be there, a lot of names will be there. You have to produce generic module to produce the evidence, and this will work. This module will work for you. So slowly they are developing and developing the studies. So first you can advise, it is when you are not having yoga setup, you can advise wherever yoga is there, you go and practice, but don't leave this medicine. వాళ్ళు పోగానే ఏం చేస్తారు, మీరు మందులు ఉంటే ఆపేయండి, మీకు అన్ని తగ్గుతాయి యోగతో అని చెప్పేస్తారు. దట్ ఇస్ యూ కాషన్ దెమ్, డోంట్ స్టాప్ దిస్ మెడిసిన్, do practice yoga, you will get little improvement, then I can tap up. If you're having a yoga teacher and having standard modules, you try. Every practitioner can try. Now we are a lot of psychiatrists are coming. There a lot of time is there with the psychiatrist. So you experience personally by doing yoga. First you have to practice. Then that modules will be given to the patient under your supervision. But yoga teacher should listen to you. If there is any flare up during the process, immediately you have to stop. Sometimes flare-ups will be there. So I'm having some other, even I am using Gayatri, there's a Lagu Sandhya. What I use, the not Sandhya Vandanam. Sandhya Vandanam is for Gayatri Sadhana, Sandhya Vandanam has to do Trikala Sandhya. That cannot be possible for the illness group. Wellness, okay, it can be done, that is a different matter. So most of the people are ill people will come for us. We have to produce a module for them which suits. And sometimes it flare up. If you give overdose, it will flare up. And don't give unusual, everything will become down. So you have to be on medicine, relapse rate will be decreased, the dose, amount of the dose will be decreased. That is the thing. Now we are not in position, research is also not in position, the yoga is not completely replaces the treatment. So you have to be a patient, keep on the medicine. If anything odd, you caution and send to the yoga teacher. And whatever, when every person will have belief on some yoga teacher where you learn, then send supervise. That is supervised yoga training under psychiatrist. That will be done. The threat should be continued. Then if any flare up comes, you should be careful. Then meanwhile you stop. So many persons go to Vipassana, the flare up will come and come. So there are every yoga will have in some effects that will have different session. I think this is enough. I think I answered you. If anything more.
Thank you, sir.
Sir, good evening, sir. Sir, are there any specific yogas for specific diseases, like for mild anxiety disorder or mild depression? Are there like the yoga, or it is the same for everything, for schizophrenia?
Yeah. Good evening, Minaj, and thank you for this good question. What I am practicing, because I am practicing yoga since last 30 years.
Yes.
And
Sir.
with 30 years practice, I developed 4 tracks of yoga. And I found yoga gives repair to hardware, that is brain. White matter and gray matter, neuromines and are neurotransmitters. It is repairs the hardware and some neurotransmitters also. But cognitively, for example, even Jacobson's, I have given Jacobson's to some people after 2-3 years. Again, I give Jacobson's to fluoxetine 20 milligrams or long-acting fluoxetine. Whoever OCD patient or depression patient, slowly I taper to the fluoxetine 1 capsule, then long-acting fluoxetine, then the therapy. So if you want to go specifically, there's an enhanced modules are there. It will be available in the website also. You go to your integrative medicine and you Google it, you will get it. And there are yoga neurotic module is there, and you can download and you can practice. And if anybody have assistance, I will assist you. And psychosis, there are different modules there. But I'm practicing only single module for everybody. And I'm having my own module of after yoga therapy. I will be admitted for 1 week. In 1 week, every day the yoga will be there. 3rd day, 4th day, I will tell how yoga works. I'll take all these examples. Asagara Madana, this, that. So there is some first track is the standing postures, then sitting postures, then the pranayama. In pranayama, there are different things. The 3rd track, 4th track is the chakra opening. There is Kundalini chakra. These are all the things. So how these are working, I will tell. What is brain? in the brain, what is happening with this, we have to explain. So I will explain the 4th day, 5th day, 6th day, 5th day, 6th day, I will give a module for neurotic disorders, total acceptance therapy. That is a that is total acceptance. You accept the mother and father, Matrudevo, Pitrudevo, Acharya. That is a mantra yoga. Now, for example, Gayatri mantra is the what I believe and I am practicing also. Gayatri is a the therapy. You go to meaning of Gayatri. The mantra yoga I practice as a for software to the anti to the psychosis distortions. That's a Gayatri. Usually the wellness, most of the orthodox people will do the Sandhya Vandanam, that is a mantra, yantra, tantra. In yantra is a mechanical power of the mantra will be there. So all 24 letters of Gayatri is the labials and tip of the tongue. So this will improve the frontal lobe activity and executive power. There is a tantra is a procedure, that is a Sandhya Vandanam. You cannot tell whole Sandhya Vandanam to the your ill patients. That's why Lagu Sandhya is there. Even Lagu Sandhya is practiced by so many persons. Even short form of Lagu Sandhya can be given without losing the principles of therapy. That is, there are some principles, I cannot explain all the things here. But that is, for hardware repair, yoga, that is asana. For software repair, you have to go to higher level. That is, as Mrityunjaya mantra for mood disorders, Gayatri mantra for schizophrenic psychosis disorders after stabilizing. Mrityunjaya mantra is mood stabilizer. After stabilizing the mood, then you have to practice that. For that also, you have to tell how this works. What is this, the meaning of this mantra? How it works? And I will tell the Trikala for Hindus, Panchakala Pratana for Muslims. I just namaz, if you go to Islam, 99 names are there for Allah. So whatever there in this, if you go through every 99 meanings of 99 names of Allah meaning, you can formulate it. So this morning, they do namaz 5 times, they will do 5 times. Then the same principles I'll incorporate in that procedure and Islamic model. Then Christian module also there for AM, same psychosis. So we should not interfere in the religion. You don't tell Gayatri to the non-Hindus. So you have to prepare. If you understand the principle of how Gayatri is working, then you can produce a module for the other religion. Even Mrityunjaya mantra is for mood disorder. Then you have to prepare that module for the different religious persons. Don't interfere into their religious beliefs. Spirituality, this is a spiritual level practice, especially the mantra. So you go to higher evolution, then you have to know how to integrate. What is happening? Ego boundaries will be disturbed in psychosis. Then the reality distortion will be there. Judgment will be impaired. Insight will be impaired. Then the abstract thinking will be impaired. How this is improving that, you have to understand first. Then what is the meaning of this? Then explain it. Then cognitively it has to be acceptable. Then they will practice. So this is the process. The same thing can be practiced in illness and wellness. Illness, you cannot practice fully. It is completely supervised by a psychiatrist, which is expert in both psychiatry as well as yoga. Not only ordinary asanas, you have to higher yoga, that is even mantra, other things are there. So I don't want to tell at this level. For everything, 2 days workshop is necessary. I'm planning a workshop shortly. My children are coming to take up my OP. Then I can probably do that. The 2 days workshop is necessary. And there, the yoga module has to be given 1 day before. Then you have to tell the science of yoga, that is asana. Then you can tell what is the mantra, how it helps. And you have to explain in the morning, afternoon, why you are doing. What is the importance of Sandhya? What is the importance of Sandhya Vandana, where you are praying the sun or there is a power in the sky which is holding the whole solar system. That is a lot of things will be there, but specific to Minhas, so there is a separate modules available for Nimans. From every disorder, they are having yoga. Don't go to more than yoga at present.
Thanks a lot, sir. So nice.
There is a one
Thank you,
question.
sir. Dr. Mavidala Srinivas, sir, మీరు అన్మ్యూట్ చేసుకొని మాట్లాడండి, sir. You can ask the question, sir.
Yeah, sir. There is no question, sir. Only one observation is that psychiatrist లో మీ దగ్గరికి వచ్చిన పేషెంట్స్ మీరు వాళ్ళ ప్రాబ్లమ్ ఏందో డయాగ్నోస్ చేసి మీరు మెడిసిన్స్ రాస్తున్న క్రమంలో another 2 to 3 minutes if you can spare time and talk personally to them, వారికి ఒక కాన్ఫిడెన్స్ బిల్డప్ చేసి మెడిసిన్స్ తో మీకు తగ్గిపోతుందని, దాంతో పాటుగా యోగా ఆసనాలు చేయడం వల్ల, సింపుల్ ఆసనాలు చేయడం వల్ల ఇంకా ఇంప్రూవ్మెంట్ అవుతుంది అని మీరు ఒక మాట చెప్పగలిగితే దట్స్ రియల్లీ వర్క్స్ వండర్ సార్. ఎందుకంటే మెడిసిన్ వేసుకోవడానికి కన్నా ముందు ఆసనాలు చేయడానికి ఇష్టపడతారు, ఎందుకంటే అది ఈజీగా చేయగలుగుతారు. మెడిసిన్ వేసుకుంటే ఎంత వర్క్ అవుతుంది, డిపెండెంట్ అవుతారా అని రకరకాల ప్రశ్నలు మైండ్ లో ఉంటాయి. కానీ దాంతో పాటు సింపుల్ ఆసనాలు వేసుకుంటే కూడా కొంత రిలీఫ్ వస్తాయి. అంటే న్యూరలాజికల్ డిజార్డర్స్ లో చాలా బాగా పనికొస్తాయి నా అభిప్రాయం. సో I request all the doctors to kindly keep in that mind. And I really see Dr. Jajireddy sir doing this. And thank you very much for giving me the opportunity. And congratulations for organizing such a wonderful workshop. Thank you, sir.
Thank you, Srinivas garu. Thank you.
Sir, there is one question from Rekha Lagu, sir.
Yes.
Any yoga for insomnia?
Yoga Nidra.
Yes.
The Yoga Nidra, it is given in Hyderabad. Most of the psychologists is giving Shivakumar. Narendra used to give Yoga Nidra, and Shivakumar learned from him. And the other psychologists, young psychologists, clinical psychologists learned the technique, and the Yoga Nidra can be practiced.
Yes, sir. If there are no more questions,
Sir, there appears to be one more, sir.
Yeah.
Sir. Thank you, sir.
Madam, Nirmala Madam, are
And
you there, madam?
I want Nirmala Madam to respond. I can learn something.
Yes, sir.
If it
Madam,
is I'm telling, I can correct it also. Yeah, because
what your message, madam, for all of our psychiatrists who are in this group, psychologists are there.
Yes.
There's so many people. How do you encourage us to help our patients to practice this wonderful art of yoga?
Yes. So before that, I would like to say, Indaka sir chepparu for insomnia, Yoga Nidra really works wonders. And I would like to add one more pattern of breath work, which has really helped my students. That is the 6-7-8 breath work, which is known as. This really works wonders. You don't require a sleeping pill after doing this breath work. It is known as 6-7-8 in a layman's term. Okay, so 1 to 6 is inhale, 1 to 7 is holding of your breath, and 1 to 8 is exhalation either through your nose or mouth. This has been very, very helpful in controlling insomnia. Along with Yoga Nidra. Yoga Nidra is the best, and this is easier for them to follow because Yoga Nidra, you require an instructor, somebody to guide them. But the 6-7-8 pattern, they can do it on their own, which is really helpful for them. So this was just a suggestion, sir.
Thank you, madam.
And as sir said, people generally, when you suggest yoga, people, the minute they start doing yoga, they stop the medication on their own, thinking that yoga is going to help them. 1 and 2 sessions will not help. Actually, yoga takes a little longer time. So I would request all the doctors to tell them that they need to continue with their medication. And then later on, once they continue yoga, you need to decrease the doses very slowly. Because I have seen in many cases, the minute they think they join yoga, okay, let me stop off the medicine because yoga is going to help me. No, that can really flare up the whatever issues they have. So on a daily basis or weekly basis, slowly under the guidance of a doctor, the dosages have to be reduced. This way, yes, it can help them. And for any health issue, there is a cure in yoga. Except in 2 cases, yoga doesn't work. One is accident cases and one surgical cases. You can't do yoga during these 2. Other than that, everywhere yoga helps. It can be any health issue, yoga can take care of it. That is what I would like to suggest.
Thank you, madam. Thank you very much. Pawan, any more questions from the chat box?
Sir, I'm just going through, sir. Sir, Sri Puja Siddham Shetty. Okay, it's only nothing, sir.
Yes. Yeah. I think if there are no more questions, I would really thank Nirmala Madam for being our chief guest and a practical person who's got the experience of doing yoga, and I'm fortunate to be your student, Madam. I think I'll be in a better position to help my patients to practice yoga for better health. And
Yes.
Being the chief guest, Madam, we were fortunate because a person of this caliber of so long experience and doing yoga, and I see how many praises your students give you. So I think we cannot get any other better chief guest than you, Madam. Thank you for being here, Madam. And
Thank you. It was an
hope
honor for me to talk over here. Thank you for the invite, Mr. George.
Thank you, Madam. And
Thank you.
we'll keep in touch with you, Madam. Wherever we need help from you, Madam, our association will contact you, Madam.
Sure. Absolutely. It's my pleasure.
Thank you, Madam. And
Thank you
Kishen
all.
sir,
Thank you all for inviting.
thank you, Madam. Kishen
Thank
sir,
you.
thank you very much, sir. I think today's presentation was really helpful, sir. I think we will definitely use it in our practice. And though I think in this lifetime, I may not be able to get your yogi level of consciousness, sir, but I should definitely try, I feel, sir. The way you counsel patients, linking up science and spirituality, I think that's one thing we all should learn, sir, whichever we follow. Kishen sir, on a short notice of 2 days, sir, we organize this program, and thank you for accepting to be our speaker, sir. And the last session we are going through. I think before I do that, Pawan, thank you, very much. Minas bhai, thank you very much. Narendra Garu, Sai, Vishal, thank you for doing wonderful job. Harish, Funny, all of you have done wonderful job. We could see attendance reaching about 100, near to 100. I think that was a good attendance. Thank you very much, Pawan. It will over to you.
Sir, now I request Dr. Kambampat Narendra sir to propose the vote of thanks so that we can conclude, sir.
Thank you very much, sir, for giving me this opportunity to propose vote of thanks.
Now 1 minute.
First,
Thank you very much to George and total and Pawan and the whole EC of Telangana State. I am congratulating advance has done wonderful activities, and I think next EC we are going to do your closing things, lot of surprising things also we want to see, and your performance of whole state under your both president and secretary are dynamic doing. I think I will be it's a very happy ending with this program.
Thank you, sir. Thank you, sir.
For giving and part of you, and thank you. And George, you are already a yogi. Your student life itself, you are trained in JFK school, Jiddu Krishnamurti. That is probably the secret of energy what you are having. I think it is my interpretation. Thank you.
Thank you. Thank you, sir.
You are catching Nirmala Madam to continue that process. Thank you.
Thank you, sir.
Over to
Narendra, over to you.
Narendra sir, please.
I thank Dr. Kishen sir for sparing his time and delivering this very wonderful lecture. I thank Nirmala Madam for sparing her time and to be with us, advising us. And I think our association with our society continues. I thank Dr. George sir and Pawan sir for giving me this opportunity and providing the infrastructure for this webinar. I thank Dr. Minhas sir, Vishal Akula, Sai Krishna, and other dignitaries who attended this webinar. Thank you, Ananda.
And Narendra Garu, I'll take this privilege to thank Anil Martin, our Anil. Thank you very much, Anil. I think you have done a wonderful job all through the year and last year. I think without you, we couldn't have organized so many Zoom programs, and you are never late. You are on dot time, and your punctuality, I think I should learn it from you. And thank you for your time, Anil. Wherever you are, you will always take care of our programs. From my heart and on behalf of all the Telangana State Branch members, Anil, hope we continue our association with you in the future years. Thank you, Anil.
Sir, Saini Pharma.
Yeah, and
Yeah.
Sir.
thank you, Saini Pharma, Hemant Ramarao garu, for sponsoring the event, and hope you continue to sponsor academic events like this, which will help us to practice better. Thank you.
Sir.
Pawan, with that, we'll close the session.
Sir,
I'm congratulating both Pawan and George to take a wonderful message from Gangadhar.
Sir.
Blessing to all state branch.
Sir.
I think we should remember that.
Anta George sir, sir. Sir, sir thought process.
Probably both